My background is 25 years plus of nursing, basically specializing in anything ICU for adults, cardiovascular ICU, surgical ICU, med surg ICU, cardiac ICU, everything ICU. I also have a background as a legal nurse consultant where I help attorneys look at cases, medical malpractice cases to see if they were meritorious. I also have a background as a home health nurse and also as a home health infusion nurse, where we did IV, IG infusions in the home. So that's my background. Your healthcare nurse advocates. We're educators, advocators, and navigators. So I want to make sure that we are not confused with a home health company. We are not hands-on. So as nurses, we can help you navigate the complex healthcare system. We can go to doctor's visits with you, tell you what's next. We can discuss medications, disease processes with you in that doctor's visit. Or if you just don't understand what resources are available, we help acclimate you to those resources. If you are having difficulty getting to your doctor's visits, we help you arrange transportation. If you are having difficulty understanding your doctors of what their game plan is, we help you have a voice at your doctor's visit to help you build that healthcare team. It takes a village to raise a child, right? So we go, it takes a village to navigate your medical care or for the person that you love. So that's what we do. Educators, advocators, and navigators. I had this idea when I was working in the hospital, two reasons. Professionally, when I was working in the hospital in the ICU, people would come in and basically, we don't care about anything else that's going on in your life. We basically want to treat you and treat you. We may change some of your medications that your existing physicians have already changed. And then after heart surgery, that's a life-altering experience. And I, as a nurse in the ICU, never had the time to really sit with someone and explain to them medications, how their life was going to change with different avenues. And so what I saw was people coming back into the hospital because the healthcare providers did not have the time to really help you understand, let alone your family members. A personal reason was my mother, about the age of 52, I was working in the ICU on the hospital education committee, on the hospital hypothermia committee, educating nurses coming in on, recovering open heart bypass and just tremendous roles. But my mother started getting sick about the age of 52. And she was showing some symptoms of, it looked like MS, but it also looked like Parkinson's because they have some of the same symptoms, but they're treated totally different. So going back and forth to the doctors, taking her to the neurologist, to the pulmonologist, to different doctors, trying to find out what it was. And at the time, they were saying she was too old for MS, because you usually get it in your 30s, and she was too young for Parkinson's, because that's a later in life type of disease process. But it was an 18-month journey going back and forth for testing, very frustrating. And then also calling my sisters and saying, can you take mom to the doctor? Well, I can, but I don't know what you're talking about. Or, mom definitely couldn't go to the doctor herself and be able to understand anything. She also had asthma, where she had to see a pulmonologist, especially during seasonal changes, where she had to go in and get allergy injection. She had to wait in the office, make sure she didn't have an allergic reaction. So that's about 3 hours out of the day just for that physician. So then she had the neurologist, the pulmonologist, her primary care doctor. She also had an oncologist because she had colon cancer. And I'm forgetting one doctor. Oh, a gastroenterologist, because she ended up having to have a feeding tube because the disease process of MS and Parkinson's were, having her difficulty swallowing. So that's 5 physicians that we had to try to navigate. Can you get off? No, I can't get off work. Can you get off work? No, I can't get off of work. And that was so frustrating for us at that time. And I thought about, Well, what if I was a layperson, didn't know nothing about healthcare? I have a loved one that has to go to these doctors, and they really don't have the time at the doctors to sit with you and really explain. It's very rare that a doctor has time to really sit with you for an hour or 30 minutes or 15 minutes and explain to you how is all this going to connect in your life? What lifestyle changes do you need to have? Nobody has time to do that. So I said, if I could have hired a neurology nurse at the time, I could stay at work, take care of my things that I have to do at work, and pay that nurse to go with my mom to the doctor's visit, explain to me the good, the bad, and the ugly, individualized. Now, healthcare, I just got on another soapbox, likes to use an individualized plan of care. It's not. They basically, you're put in a box with all the people who have MS or all the people who have Parkinson's or all the people who have, those are called clinical pathways. They're not individualized plans of care. So I said to myself, wow, I would love to pay a nurse to go with my mom to those doctor's visits and be able to explain to us what's next. Because as nurses in our professions, we specialize also. So cardiovascular, I'm thinking heart, lungs, kidneys. I'm not thinking about neurological diseases. So I had to go back and get myself re-educated. So that's when I came up with the idea of, wow, if a nurse could go with you that specializes in whatever disease process your loved one is suffering from and kind of hold your hand and guide you through that process. Wow. So that's why I came up with Your Healthcare Nurse Advocates. It hasn't really changed. It's just been enhanced. It's bigger now, right? Because so much education is needed for people. People are so lost and frustrated with the healthcare system. And I want to increase that trust back into the healthcare system. I want to help people learn how to, yes, I can say that. I can have a voice, but it's how you say it. I want people to be able to feel like they are part of their healthcare team, not going to the doctor and saying, okay, what's next? Being able to collaborate with their physicians, being able to educate people on, hey, we're okay now, but we need to start looking at what could happen 3 months, 6 months, 9 months down the line so we can get prepared for that now instead of running around all chaotic when the crisis occurs. And then nobody knows who does what, when, where, why. So our mission is to help you be empowered as a patient or as your loved one when you're traveling through this complex healthcare system. It's ever changing. What problems? I think we increase awareness of you being empowered to make decisions, but you have to have that foundation of education of what your decisions could or could not be. I just think, in our healthcare system, it's so complex and there's so many avenues to go down. And then lots of times healthcare providers don't have that time to learn that who you are and what are your family dynamics, because you're a whole person. It is financially, it is spiritually, it is professionally, it's emotionally. Then how do you put all the puzzle pieces together, right? So that's what we are attempting to do and help increase that awareness. We love trying to spend some of our time volunteering with nonprofit organizations to help educate. So I think education is key. Not only do we partner with nonprofit organizations, we also have implemented our own program of teaching people how to build their medical binder. Education, education, education. So it's all about, how do you have a voice? What do you say? How do you say it? What do you look for? What are your labs? What are your procedures that you need to talk about at that visit? So we teach people how to build their own empowerment tool for their healthcare journey. So education, I love it. We help educate the doctors that we are working with, the home health companies we are working with, anybody in healthcare that we're working with to help the clients learn how to advocate for themselves. Number one misconception is that we're providing private duty nursing services. So because healthcare advocacy is a new industry, there are a lot of advocates that are working in the hospital or working in the surgical centers or working for an insurance company or even working for a doctor. They're in the form of social workers, geriatric case managers, certified case managers in that form. So the biggest misconception that I'm having to learn to plant seeds is that healthcare advocacy is a new concept business-wise, but it's really so diverse. So some healthcare advocates help you navigate insurance. We don't do that. That's another misconception that people say, oh, well, you take insurance. We don't take insurance. We're strictly private pay because insurance at this time does not know how to pay for these services. So there are individualized healthcare advocates that you'll see growing throughout the United States, that some of them just help you navigate your hospital bills. We navigate your medical care. We love to be there with you, holding your hand, helping you understand your medications, your disease processes, how they affect you. So I have to do a lot of explaining that, we're not a home health company. We don't provide private duty nursing or anything like that. So I kind of equate us to think of a business advisor or coach. We are your healthcare advisors or coaches. So my top 3 things are when you're looking for an advocate, there's several sites that you can go to. You can go to www.advoconnection.com, or you can go to www.gnanow.org. So there's several organizations that you can go through. But what I say is that you can go, what is your problem? Is it medical? Is it insurance? Is it billing? Things like that. It just depends on what your problem is. That's what I'm trying to say. And then you want to look at the credentials of that advocate. You want to see what his or her work history is. What are their credentials? Are they certified? As in board certified patient advocate? Because there is an exam that we have to take that is nationally recognized, that we have to know. We have to have that foundation of knowledge. Most of these agencies that you can go and look up and find an advocate in your area, they do require their advocates to be background checked, fingerprinted, just the things like that. And then look at their work history, look at their credentials, look at their website, look at what people are saying about them, what area have they been working in. So when you're looking for an advocate, and look for testimonials too, who has worked with that advocate before. I just go back to the credentialing. I mean, it is so important, in my opinion, for advocates to have that work history. So if you're an advocate and you're working in insurance navigation, well, I would want someone who's been in that insurance world. Maybe they got a history of being in that insurance world. If I want a healthcare nurse advocate, then I want to make sure that nurse has some experience in the field that my loved one needs that, experience in. Like I said, all advocates are not created equal. So you got to be really strategic about when you're hunting for an advocate. Well, I'm doing a lot. So number one, you can go to my website at www.yournurseadvocates.com. I also have a YouTube channel. The YouTube channel is just Deidra Kindred. It's Deidra, last name Kindred, like the hospital, Kindred. And on that YouTube channel, I put just different, healthcare topics. I also have a podcast. The The podcast is Health Chats Among Friends, where I bring other industry professionals on to help educate the public about the resources that are available in our local communities. And it's actually grown to almost nationally because I've been able to reach other healthcare professionals that are doing some amazing things nationally. Let's see, the podcast, the YouTube channel, the website, and now I'm going to start doing what we call roaming workshops, teaching people how to be their own advocate. They're going to be health and wellness workshops, and we are going to educate and empower the public.